Today, we wanted to spend some time to separate fact from fiction about the issue of wearing masks. I'm Amy Wood, Lexington District One's Nursing and Health Services Director, and we're pleased to have with us again Dr. Jane Kelly, Assistant State Epidemiologist with the South Carolina Department of Health and Environmental Control. Dr. Kelly, thank you for joining us again.
Oh, well, thank you for inviting me.
Recently, we've received many questions and opinions related to the topic of masks. Can you tell us, as more adults get vaccinated, why does someone need to wear a mask right now?
You know, right now in South Carolina, about 41% of adults age 16 and older have had at least one dose of vaccine, and 30%, a little bit more than 30%, are fully vaccinated. Well, that's good news, you know, to have almost a third of people vaccinated, but that also means that 70% are not vaccinated. I mean, 30%, that's nowhere near enough fully vaccinated for us to let our guard down now. Thankfully, we have seen a decrease in new infections, in severe disease and deaths. But, you know, the percentage of cases among children is actually on the increase. And while most children and teens have mild illness, some don't. Now, I don't like to scare people, but the truth is we have seen in South Carolina over 100 cases of the multi-inflammatory syndrome in children and some pediatric deaths. I mean, we still need to wear masks because wearing masks protects people who are not vaccinated, including our kids.
So is it important for students to wear masks?
It is important for students to wear masks because masks do save lives. Masks do work. I can show you study after study after study that demonstrate the efficacy, the effectiveness of wearing masks, and that wearing masks is an important part of prevention of transmission disease in schools. And I'll give you an example. You know, sometimes people talk about, well, aren't the number of cases in schools really low? Do kids still need to wear masks if the cases are really low? And the example I'd like to give you is seatbelts. Now, I've been around long enough to remember when there was not a law about wearing seatbelts. And when that law went into effect, people were upset. A lot of people didn't want to be told to wear seatbelts. But the number of deaths from motor vehicle accidents plummeted. So when that happened, when the number of deaths became low from motor vehicle accidents, did we say, now we can get rid of the seatbelts? No, because the seatbelts were what was protecting people from dying in an accident. We still have virus circulating in South Carolina, and we still have variants that are more contagious, that spread more easily. So yeah, we still need our students and our adults to continue to wear masks.
Can you review with us again, how does wearing a face covering help keep the spread of COVID-19 low?
Sure. Well, first, you have to understand that SARS-CoV-2, the virus that causes COVID-19, is spread by respiratory droplets. In the very beginning, we thought, well, maybe it's surfaces, and we were disinfecting everything, you know, just trying to understand, do masks work or not? Now we have so much evidence that masks do work. Now, sometimes I've heard people argue, well, masks, they're a cloth, and the weave of that cloth is not fine enough. I mean, virus particles are tiny. They could go in between those threads. Yes, of course. But viruses don't travel on their own. They travel in moist droplets. So if you can wear a mask and block those droplets from coming out or going through, then you're way ahead of the game. So wearing a mask, if someone is infected, blocks the droplets from that infected person from getting out into the air, or at least from spreading very far when they cough or shout or even talk or breathe. For the person who's not infected, wearing a mask helps protect them from and blocking, forming a physical shield to keep those virus particles from going through. Now, it might be true that one or two particles are still going to go through, but it's a dose response curve, meaning that if you get a big dose of viruses that you inhale, your chances of getting infected are higher. If you're wearing a mask and the other person is wearing a mask, it greatly decreases the number of viral particles that can get through. so that it'll help protect you from getting infected.
Is it true that wearing a mask means that you're breathing in your own carbon dioxide all day and you're not able to breathe enough oxygen?
You know, this question always puzzles me. Nurses and doctors, myself included, have worn masks for day in, day out, 8 hours, 10 hours in a day for years. I mean, are you really concerned that your surgeon is dizzy from high carbon dioxide or low oxygen levels in their blood? I mean, the masks that we're talking about, you know, the surgical or procedural masks, they're the paper masks that you it's for once daily wearing. You can't wash them and use them over and over again. But those are the masks that have been used in medical settings for decades, and yet we've not seen health consequences. And, you know, in terms of not getting enough oxygen, these molecules are tiny. They're tiny. They are smaller than a virus particle. They can get in and out of your mask, even through a cloth mask.
Is it true that wearing masks is not good for our mental health?
Well, you know, that's a cultural issue because in China, Japan, other Asian countries, people routinely wore face masks when going out in public just to cut down on regular respiratory virus infections like the common cold. They did that for many years before COVID-19, and they continue to do it now. I mean, this was true for all ages. People put masks on their kids in Asian countries, and people from mask-wearing cultures find that those masks are reassuring. They feel they're being protected from infection, and indeed it is protecting them. In the United States, we're not used to wearing face masks. In the medical system, we are, but not in everybody else's day-to-day existence. So of course, you know, getting used to a new phenomenon, wearing masks is new for people. So of course, for a lot of people, I understand it's been anxiety provoking. They're not used to doing this. But, you know, at the same time, for other people, it can be a symbol of pride. I've seen people wear masks that, you know, sport their favorite athletic team or their school, or they've got a self-affirmation quote, or even a military affiliation. So is it true that wearing masks is not good for our mental health? No, it's not masks themselves. It's how people interpret them. You know, is wearing a mask a protection? For me, it's a protection. If you feel that it's something else to you, then I think you need to think through, why do you feel that way?
Why can't masks be optional for those who don't want to wear them?
Well, that's because this virus doesn't care what you want. During a pandemic, we need measures that protect our entire community. We're all in this together. So the reason we have some mask requirements, even for people who don't want to wear them, is because that's the public health measure that has been adopted. You know, people who don't wear masks, the fact is they are at higher risk of picking up the virus and then spreading it to others. There is an exception to that, though, for people who are fully vaccinated. And by fully vaccinated, I mean at least 2 weeks after your second dose, if you got Pfizer or Moderna, or at least 2 weeks after your single dose of the Janssen vaccine. The CDC guidelines state that if you are fully vaccinated, you can get together with other people who are fully vaccinated, indoors, no masks, no distancing, and you can get together outdoors without a mask, as long as you're not in a crowded situation. But when we're talking about a school situation where people are together for hours at a time in close quarters, masks help to protect those children. And we don't have a vaccine for children under age 16. Everyone wearing masks in indoor settings is the best way to protect our children.
So let's talk about outdoors. Are masks necessary when classes are at recess or if they meet outside for something?
This is a school district decision. CDC doesn't have specific recommendations for this instance, this question about kids at recess. What I would say, and this is my personal opinion, but I would say that it is reasonable that if children are outdoors, physically distancing, meaning being at least 6 feet apart, kicking a ball around, but they're 6 feet apart from each other, to consider not requiring masks in that setting.
Is there anything that we have not asked you about face coverings that you think we need to know?
Well, I just want to bring home again the message that masks do work. I could give you lots of studies and show you graphs and figures and data on that, but instead I'd like to just tell you one story, because I think this one story says it all. And this isn't a school story, but I think it's still pretty compelling. There were two hairstylists who were pre-symptomatic. That is, they had COVID-19, but they didn't know it yet. You know, you can be contagious up to 2 days before you develop symptoms, and that's exactly where they were. These two hairstylists served 139 clients, but they not only wore face masks, they required each of the people that they worked with to wear a face mask as well. You know that they're within 6 feet of them, they're working on their hair. And you know that it's at least 15 minutes, probably a good bit longer than 15 minutes. And you know they're probably both talking the entire time. So what a setup for transmission of disease. Well, when those two hairstylists found out they were positive, they recontacted those 139 clients and urged them to go get tested. Not a single one of them was positive. They all wore masks, and masks do work.
Some of our folks in our community are referencing a study by someone claiming to be attached to Stanford. Can you clarify whether that information in the study is in fact correct?
Oh, I am so glad you brought this up, because I've gotten this question from a number of different people, and I think it is such a worrisome thing how much people have been frightened by this paper. So let me tell you the deal on this paper. This is the one that you're referring to, is in a publication called Medical Hypotheses. Now stick with me, because I've got a few things that I think are really important to understand about this. I would caution everyone in their interpretation of papers published in Medical Hypotheses. They're not studies. They're opinion pieces, like articles in the editorial page. Now, it's good to read opinion pieces, but you need to know the difference between somebody's opinion and somebody who's got studies that demonstrate facts. So I want to read you a little something from their guide for authors. So if you want to publish something in this particular journal, you go on their website to the guide to authors, and they'll tell you what papers they'll accept. And I'm going to read this, verbatim. So, quote, "The purpose of Medical Hypotheses is to publish interesting theoretical papers. The journal will consider radical, speculative, and non-mainstream ideas. This is not a journal for primary data." So they say right up front that these are not facts. These are somebody's, kind of speculations, their ideas. The publication asks for authors to pay an $1,800 fee for it to get printed. So just like I would caution people not to believe everything they read on social media, be skeptical, ask questions, I would be skeptical about believing without questioning something that's printed in a publication that expressly states they will print anything as long as you send in your $1,800 fee. I mean, I really worry about people being fooled. This looks like a credible source. The guy's from Stanford, right? So I looked into this some more. It turns out he isn't from Stanford. Stanford University, in fact, has released a statement. Stanford, quote, "Stanford University has never employed Baruch Weinschenboim. Several years ago, 2015, he was a visiting scholar at Stanford for a year on matters unrelated to this paper." A visiting scholar is like a student who comes and spends a year, except it's after graduation. It's like a postdoc. He was never paid, never employed by Stanford. He, selectively chooses his references. He misquotes a number of references. And the thing I find most interesting, Stanford has not only disavowed this paper, but the actual journal itself, the Medical Hypotheses, they've retracted this paper. Now, how many people know that? We've got parents scared to death over this paper that is non-factual. How can we help people understand what is a study with actual data, with actual facts, versus something like this. I mean, I don't understand this person's motivation for publishing this. Maybe it's to advance his career. It's good to have more and more publications under your name, or whether he is, a little bit more fringe and is publishing something that, but I know it's done tremendous damage in frightening parents. And I just encourage people to, if you're skeptical about medical facts and you want to do your own research, make sure your own research is at reliable sources. And you've also got reliable sources to talk to. Talk to your physician, talk to your pharmacist, not just talking to the people you don't even know, but who are somehow managing to get through on your social media. This is what I was talking about, factcheck.org. So here's a resource for you. This particular link talks about that, quote, Stanford, which misinformation on face masks. I'm not going to cover the entire article here. I just want to give you a place that you can go if you hear a rumor or you hear something and you think, I don't know, is that true? What are the facts? What's the background on this? This is a project of the Annenberg Public Policy Center. This is out of the University of Pennsylvania. This is not a government site. So this is one trusted resource you can go to get more information about recent publications, rumors, myths about COVID-19, vaccinations, masks. This is another one I just want to use. This is USA Today, and I find that this article might be a little easier to read than some of the other resources. But again, their headline here is fact check. Study falsely claiming face masks are harmful is not linked to Stanford. So Stanford University said, we don't know this guy. And the very fact that the journal published it without even checking whether the author is really from Stanford, makes me feel like they did not very carefully check the other facts that were presented in this paper. I want to talk to you a little bit about the virus variants that we are seeing in this country. In this map of the United States, you can see the distribution, where B117 or the UK or British variant is. It's in every state in the United States, and it's here in South Carolina as well. The situation with this variant, the importance of this variant is that it's more contagious. It spreads more easily. And right now in Michigan, they are having a terrible time with this variant because they have a huge increase, a surge in the number of pediatric cases who are ill enough that they need to be hospitalized because of this variant. So our concern in South Carolina is, yes, our number of cases, it has been decreasing, and that's good, that's reassuring. Our fear is that this variant, if it takes hold in South Carolina and really starts to spread, that we're going to have a surge also. The number of cases are going to increase. So 2 reasons for wearing masks. One is to avoid getting infected with any variant, with SARS-CoV-2, but the other is to keep this variant at bay because it's more contagious, spreads more easily. We are concerned that it might become the dominant one. And as long as we're talking about the British variant, I think we should also talk about the South African variant. That's B1351. And in this map, you can see it's in most places in the United States. And yes, it is here in South Carolina. And the deal with this variant, it not only spreads more easily, it's more contagious, but also it is more resistant to antibody. The good news is right now, the vaccines we have available to us work against both of these variants. However, we're worried that if these variants can arise, other variants can. This virus mutates, and if it continues to mutate and comes up with a strain that vaccine does not work for, we're going to be in trouble. Wearing masks is a fight against the development of these variants. Vaccination is our way out of this pandemic, but we know we don't have vaccine for every person. We don't have vaccine for those under age 16 yet. But for right now, wearing masks is our best weapon, along with distancing, to keep these variants at bay.
We've gotten lots of questions and phone calls from parents concerned about what Governor McMaster stated yesterday. Can you speak a little bit about that?
Sure. I think you're referring to Governor McMaster voicing his opinion that he doesn't feel that students need to wear masks in schools. And, we at DHEC, we understand the governor, when he makes a policy or a decision or makes a comment like that, he has to consider many different factors. But at DHEC, we have to look from the public health point of view. And where we are right now in the COVID-19 response, yes, we're making good progress. Number of cases are decreasing, but they're not low enough yet. We still have a percent positivity around 5%, and that's of concern. We could still see a surge. We don't want to see that before the end of the school year. We know that there is still community transmission. We don't want to see that community transmission translate into transmission in the schools. We are not close to herd immunity yet. From a public health point of view, we would ask parents, schools, municipalities, keep your mask ordinances in place. They have been working. That's why we have a downward trend. Why would you want to stop with something that is working? When school starts in the fall, we can revisit that recommendation. Hopefully by then we'll have many more people vaccinated. Hopefully by then we will have a vaccine that's available for kids age 12 and up, maybe even younger. I think we'll be in a different place, but not if we lose our position right now. I would just continue to urge people to do the common sense thing and stick with masks.
Thank you, Dr. Kelly, for joining us and for sharing your expertise and your knowledge with us.
Oh, it was my pleasure. Thank you so much for inviting me and for the work that you are doing in getting the facts out there.